very scary for one young woman, because a lot of young women tell me, well, I have to have BV to participate in this study. And it's like, yes, you do have to have BV, but you shouldn't be scared or afraid. It's something that we want to encourage women to come in and be more proactive in their sexual health. And this is just another screening process, just as if the woman would come in for getting screened for chlamydia and gonorrhea, you're coming in to be screened for bacterial vaginosis. And just like I said before, it's a painless process, and actually you have the opportunity to be part of a national health study that will answer many of questions down the road, and actually this will lead to an enormous amount of funding probably in the future for more research study in women, especially here in San Francisco, which is needed. We need more research to be done, especially on women of color.
So if you are a participant or want to participate, what are the benefits to you? Like you said, there was benefits towards like sort of the medical community, but for the women, what is the benefits or risks involved?
One of the benefits is that you get to be screened for 1 year for chlamydia, gonorrhea, and BV from the privacy of your own home. So if that's when you participate in the study, every 4 months you'll be screened for chlamydia and gonorrhea, and every 2 months you'll be screened for bacterial vaginosis. In the event that we see something abnormal or so forth, we contact you personally, and you get treatment for free. You see our clinicians for free, and you have access to all the services that Dr. Philip just mentioned at the city clinic as well.
So is there a treatment for BV, or is there?
There is.
Okay.
There is. And I just want to reiterate, as Nikole had said, these are women that would not normally be treated.
Right.
So we don't want to say that this is sort of a true disease state. We're just saying that we're trying to find it sort of when it's asymptomatic, when it's not causing problems, and we're trying to answer this question that we don't know the answer to yet. Will treating this condition that we don't usually treat when it's asymptomatic actually make a difference?
So are you going to follow these women,
Yes.
like when they're done with this study, or
We
done
follow
doing the
them
year,
throughout
or
the study.
Okay.
So when they enroll in the study, so just to go take a step back to the screening process, for women who come in to be screened, they get for the compensation portion, just to be screened, you get $10, which is great. You come in, you screen, you know your status. If you do qualify at that point, of course, we compensate you again an additional $25, and from that point, we would like the participant to enroll in the study for 12 months.
Okay.
So from the day that they enroll in the study, it's every 2 months from that day, we send a screening kit to their home. So the same thing that they did in the clinic for the initial screening, they do that at home in a prepackaged, prepaid envelope.
Okay.
They swab themselves from home, and they stick that in a package, and they send it to our lab. And
Okay.
we do that every 2 months, and they're compensated every time they send the kit in the mail.
Okay.
And so so that's how the process will be. And then after the last kit is in that 12 months, then we do a final evaluation, and then they've completed the study at that point.
And
then
the compensation really is because we understand that this is taking time. It's sort of
Right.
an extra thing that they wouldn't do. They have to
Exactly.
get, do the kits and then mail them. And so it's really, we're really trying to thank them for the contribution that they're making to this information. And as Nikole was saying, it's really important in research that you're doing research that's going to benefit the community that's participating and volunteering. And so there's a lot of potential here for reducing the morbidity, for reducing the bad outcomes that go along with chlamydia and gonorrhea if there's a positive result. So really, everyone who works on this study and contributes to this study is really helping to see if there might be a partial answer to this huge burden of chlamydia and gonorrhea that we disproportionately have in women of color in this country.
So is there going to be, maybe I'm not, so do they get treatment throughout the year, or they're
Yes.
just getting they're getting the treatment?
So let me go
I'm like,
through
you're
another
just screening
step.
them and then that's it, or
No.
they're getting the treatment to see if there's a link, or
Exactly. So let's start. So we have a participant. She comes to the clinic, and she actually qualified for the study. At that point, we randomize the participants. So they get a randomized number, and at that point, we open up a card and in front of myself and the participant, and it'll let us know whether they're in a treatment group or a non-treatment group.
Okay.
So we have a control group and a non-control group that we're comparing it to. And so if you're in the control group, you will not receive the medication, which is the standard metronidazole. And then you'll go through the study without receiving the medication. If you are in the treatment group, you'll receive metronidazole on that day, and the patient takes it for 1 week, two times a day. It is a pill. So it's the standard antibiotic that they would treat for any woman with symptomatic BV.
Okay.
So we give that to them. They take it 2 times a day for 1 week, and they're fine. And every 2 months, again, we follow them up. If that person still has BV, the second month they send the kit in to us, we treat them again with metronidazole, only for women who are in the treatment group. So if you are a participant, you have to be willing to take metronidazole, that medication, which is not harmful. You can go in and describe more about
it's a standard medication. The main thing that we tell people is that they shouldn't drink while they take it, because it can sort of have a bad flushing. You feel sick. I mean, if you take it while you've been drinking, and that for some people is harder than for some other people. So, but that's the main warning. It's a very safe FDA approved drug. We're not doing any experimental drugs or treatments, nothing like that. And it's important to remember that whether you're in the treatment group or the control group, everybody gets treated for any chlamydia and gonorrhea that they have. So immediately people are notified and given free treatment and any care they might need if they're found to have that. And as Nikole said, that's one of the benefits, is that most women don't have that frequent opportunity to have chlamydia and gonorrhea screening done sort of for free at their own convenience. And so monitoring, their own sexual health and their own status in terms of chlamydia and gonorrhea is another smaller benefit of the study.
And are they allowed to sort of just go about their daily routine and daily life and daily sexual activity?
That's what we want them to do. We definitely want them to do that. We don't want them to change their sexual activity just based on the study and so forth. So,
and are you hoping? Well, not hoping, but are you guys looking for that link along the way, or are you guys just sending your results to the national study, or what do you do?
The results actually come back to us. So we do have a chance to analyze that. As the results come to me, I can say, okay, this person doesn't have chlamydia on her second month, she doesn't have BV, and she's in the treatment group, so obviously that medication worked. She doesn't have a reoccurrence of BV. So actually, as I'm going, every participant has their own folder. All the information is confidential. And we don't analyze it at that time, but just subconsciously we can kind of see the data there ourselves.
Because we're part of a national study, the data is all sort of going to be put together, but it will be informative for all of us in terms of all of us who see young women clinically, or see young women as part of our roles in public health. So that's really the goal, to try and get a representative sample, because our clinic in San Francisco is very different from the patients who come there, very different from the patients that come to Birmingham, Alabama. So what we're hoping is that by putting all these different geographic areas together, we're kind of getting a common experience among all the patients that we have.
Oh, good. Well, if you are interested in this study or participating or finding out more information, even about the San Francisco City Clinic, you can go to sfcityclinic.org if you would like to contact Nikole directly. I'm going to give you her phone number, so you better write it down. It's 415-525-7718. Or you can email her at bravostudy2008@yahoo.com. If you're at all interested in even finding out more information about women's health, women's reproductive health, or possibly participating in this study. And what would you tell women who are thinking about coming in, or they're too scared, or what's your final words that you would say to women?
Just to close, I would like to encourage all women between the ages of 18 to 25 to come down to the clinic. Call my number, call me personally. You can call me anytime during the evening, Monday through Sunday. I'm available
2 in the morning. Hey,
I'm available to you. Leave a message. We need to enroll 300 women to make this study successful. I'll be out in your community. Please recognize my face. My name is Nikole. When you see me, say hi, ask me any questions, email me anytime. I'm encouraging all young women of color to participate in this. I know we have a history with research, but I want us to try to put that behind us and come out and try to really make a difference in our community, because we definitely need it. It's 2009. We have a new government in place, and it's time to make a difference, and you can do it by participating in our Bravo study.
Oh, good. And get help at the same time.
And come to the free clinic as well.
Right.
And I have connections to a lot of other resources in the community. I'm a public health major, so if you need any other resources, family planning, infant care, baby care, whatever, I can try to get those resources
call her
for
up.
you. Just call me up. Exactly.
Anytime for any questions.
See what I mean about her being the core of this study?
I know. Good thing you found her, and good thing she's here.
Yes.
Well, thank you for watching SF Live this Thursday night, and I'm Rebecca Tapp, and I will see you next Thursday at 5:30.